Detective, based on the evidence the police have so far, there's no doubt that in fact there were 3 intentional murders, right? Did these people actually intend to kill these patients?
The evidence we've gathered is quite substantial. We have videos showing these people's actions, and we also have the analysis of the medical records of all the procedures that were performed, medical actions in relation to these patients. And there is convincing evidence that the nursing technician pretended to be the doctor. He accessed the system that was open, the system used for prescribing medications in the hospital, twice pretending to be the doctors. He prescribed this medication. He also went to the pharmacy, got the medications, prepared them, hid the medications in his lab coat, and administered them into the patient's veins. And they also waited for the patient's reactions, because this medication, once injected directly into the vein, which should not be done, causes cardiac arrest. Seconds after administration, these patients would experience cardiac arrest. And this technician would still perform cardiac massage, trying to save the patient to whom he had administered the medication, trying to kill. In fact, in one of the cases, when this medication ran out, he no longer had access to it. He took the disinfectant that was at the bedside and more than 10 times injected it into the patient's vein. This also caused the death.
Why would he save someone after causing their death? Was it to hide he committed the crime?
Yes, he tried to save the patient by performing a cardiac maneuver since other team members were present when he administered the medication and injected the disinfectant. He was either alone or with the 2 nursing technicians, and in one of the cases, he was only with one of those nursing technicians. As for his relationship with the technicians and their involvement in the crime, one of the nursing technicians, in fact, didn't even work on the same ward. She wasn't part of the same team responsible for those beds. He was very close friends with her, and as for the other nursing technician, she was a newer technician who was being trained by him. The conduct of these nursing technicians was negligent. They knew what substance he was using, both in the medication and in the disinfectant. They knew injecting those products into the vein could cause death, but still didn't understand, intervene, or act. They were in the rooms, at the bedsides of those people. They saw them, and even in the footage, they show that they were watching the door to see if others would come in. So they had responsibility for the bed. They were the responsible technicians. One of them was in charge of the beds, and she let this happen and didn't take any kind of initiative. Once the hospital determined the cause of death, it promptly notified the police.
Very complicated, right? So here you can see information selected by the officer, kind of outlining the whole course of what happened in a more general way. Later, I'll make a more specific video. So what we noticed is that he accessed the patient's medical records using the doctor's password. Actually, it's very common. Okay, you're there at the computer typing, you leave, come back, maybe you don't log off anyway, but what he did was take advantage of that. With the doctor's open login, he probably didn't have the password. He accessed the patient's bed through the medical record system, went there and prescribed. Probably potassium chloride because the pharmacy would never have released it to him. He created a prescription, went to the pharmacy, took it, put it in his lab coat, and administered potassium chloride to the patient. Once we inject it into the vein, we know, right? It will stop the patient's heart. Unfortunately, the patient will die, so what did he do? He would get this medication from the pharmacy and administer it himself, causing this reaction. The patient would go into malignant arrhythmia and have a cardiorespiratory arrest. Then, for sure, everyone was called in and resuscitation was performed. And we have three patients. This happened in November and December. Of these 3, right? There are still 20 being analyzed. So what do we understand that he was doing? He did this knowing that cardiopulmonary resuscitation wouldn't work. He did all of this knowing that even with resuscitation, it wouldn't work. And for one of the patients, why did he use disinfectant? I was reading some things that have already been posted on the internet, which is that this particular patient had cardiac arrests and came back, had return of spontaneous circulation, the patient came back, and then he must have been outraged like, damn, they came back. I gave meds, he resuscitated, and the patient revived. In other words, the patient managed, even with the high dosage of that medication he took, of that substance, to achieve return of spontaneous circulation. And then what he did was, he took disinfectant. And I saw a lot of people commenting, wow, Eder, that's absurd. Where can I find disinfectant in the intensive care unit? The intensive care unit is one complete unit. There's the Department of Materials and Cleaning, the Department of Materials and Cleaning, where the cleaning staff keeps their supplies. We don't keep opening that door, and we don't leave it unlocked because we don't go in there or take cleaning products for anything. If those products are there now, we would never imagine that someone would take a disinfectant and inject it into anyone's vein. If you think like that, soon we won't be able to have people working in care anymore. So no one imagined this could be happening. So what did he think? Since that didn't work out, I'm going to get disinfectant and I'm definitely going to do it. The report says he got it at the bedside, but there's no disinfectant at anyone's bedside, at least there shouldn't be. He probably went to the supply room, got it, put it by the bedside, and started suctioning repeatedly. He injected it 10 times with a 10 ml syringe, using a total of 100 ml to inject disinfectant into the patient's vein. So it's a lot of cruelty because he really wanted to kill, really without a doubt, he wanted to kill because that's how he prepared the medication. Those who died, okay, the patient who didn't die, he gave disinfectant, guys, pure cruelty, so that's it. This is just an overview. There must be more things that will come out in the headlines, but just thinking about this, guys, it makes us feel really bad because these situations just don't make sense to us. Now here's the thing. The other two nursing assistants were not directly involved, but there was a person who stayed at the door watching to see if anyone was coming or not. For God's sake, guys, so there's a big part to this. No, because she didn't just see it, she was also complicit. Complicit because she saw it, complicit. Because she knew that would lead the patient to death and she would definitely do resuscitation there too. So why is that? It's something that's still up in the air. Why is that? And there are several theories, right? I'm not sure. Trafficking or organs? Probably not. And I doubt it's funeral homes. There needs to be a reason if there's any motivation. The only thing left is a psychopath, and I believe it's more likely to be a psychopath than something related to a funeral home. Guys, think about it. For something to be a funeral home, it must be directly linked to one. This happens when city halls have contracts with municipal hospitals or hospitals from somewhere else. Where, right? As soon as the patient passes away, the funeral home takes the body. Now, in this case, nobody knows if there was a funeral plan or something like that. So in my mind, I don't think it has anything to do with the funeral home. I was making money behind the scenes from this. No, because I really believe it's just malice, okay? But let's analyze the next chapters. I'll make other specific videos as well. But what it seems like is pure raw cruelty, unfortunately.